I think a lot of Americans don't realize like the advantage they have in terms of their starting position. A lot of people want to think that their success is because of their hard work or whatever, but like people have different, starting positions in their life.
Whatever the mind can conceive and believe, the mind can achieve.
Welcome to the Dream Big and Think Different podcast, where we inspire, impact, and empower.
Progress is impossible if you always do things the way you have always done things.
It's time to dream big. Here's your host, Dr. Sachin Maskey.
Welcome, everyone, to another episode of Dream Big and Think Different podcast, where our mission is to inspire, impact, and empower millions of people. I'm host Dr. Sachin Maskey, and today we have a very special guest who is another dreamer, Laurence Girard. Has a very inspiring story we all need to hear, and trying to do a massive disruption in the field of chronic disease, which is my passion, diabetes. And I'm very honored and privileged and very excited today. It's been a long time. I've been waiting for this with Laurence. He's been very busy. But anyway, thank you so much to join the podcast. How are you doing today?
Good. Thank you for having me on the show. I'm very honored to be here as well. And I've been looking forward to speaking with you today.
Sure, definitely. Before I get started, I want to just quickly talk about Laurence, how we met and why we're doing today, and his formal bio. So I believe I met Laurence through LinkedIn connection, and he was at that time running as a CEO and the founder of the company called Fruit Street. So that's where we got connected. But Laurence is a CEO, again, founder of Fruit Street Health Company, a CDC-recognized diabetes prevention program delivered by telehealth and live group video conference on Zoom with a registered dietitian. He has raised more than 35 million in financing from hundreds of physicians who are passionate about diabetes prevention. The company has served more than 45,000 patients with prediabetes. He's also CEO of a new company called Healthcare Ceres, early stage venture studio and venture capital, from focus on investing in early stage healthcare entrepreneurs. And finally, he's also a founder of the Hippocrates Venture, an early stage physician funded venture capital firm that has invested in several startups, including two medical device companies. Lawrence obtained his bachelor's degree from Harvard Extension School and is an alumnus of Harvard Business School, having completed a program of leadership development. He is currently a Sloan Fellow at London Business School and will graduate with a master's degree in leadership and strategy upon completion. His mission in the world is to use the power of business, technology, and entrepreneurship to improve public health. He also believes that business can be incredible force for the good in the world, and that is the responsibility of the business leaders to improve society through the business. Our topic today will be mostly focused on Fruit Street, his company preventing diabetes type 2 by telehealth. My first question to Laurence is, who is Laurence and why he's in this work?
Good question. Well, I thought I was going to go to medical school when I was 18, and I had started to volunteer in my local emergency room. But I was also taking a nutrition epidemiology course with the Harvard School of Public Health professor. And at the time, I thought I must be the only person that has ever taken a nutrition epidemiology course while working in an emergency room, because they're really polar opposites. One's focused on prevention, the other's focused on treatment. And
Yep.
I became frustrated by the amount of patients that were coming in with preventable lifestyle-related conditions. And it really spurred my interest in public health and prevention, and trying to think about how we get our healthcare system to focus more on preventing conditions rather than treating them. And so, to make a long story short, that led to the inspiration to start Fruit Street and pursue this mission of diabetes prevention.
That's amazing, Laurence. Thank you for sharing that. I believe prevention, well, I'm in medical field for more than 20 years. I'm a physician myself. And first of all, I want to put a disclaimer here. I don't have any financial affiliation with the company. No, I guess this episode is mostly learning about more of Lawrence, his journey, and what he's been doing to impact millions of people's lives. That's what I was very passionate about. So That's amazing. So, I mean, you went to medical school and started this. It's been more than 10 years, correct? The first trade?
Yeah, we started in 2014, but I didn't actually quite go to medical school. I was a pre-med student at the time
Oh,
and
okay. Yeah,
just became a public health entrepreneur, really. But
absolutely.
yeah, I started it when I was in the bachelor's degree program at the Harvard Extension School. I had some professors there that
Oh,
were physicians that started the Institute of Lifestyle Medicine, where they
oh,
teach
yes.
physicians how to, help their patients change their lifestyle. But then I got more interested in entrepreneurship because the first year I was there, they opened the Harvard Innovation Lab at the Harvard Business School campus, and
Okay.
it just changed my way of thinking in terms of thinking about like instead of just impacting one patient at a time, how can we use technology to impact public health? So it started actually the original idea 12 years ago as a summer project at the Harvard Innovation Lab, and we had some physicians invest and some business school alumni invest, and then I basically went on the route of being a public health entrepreneur instead of being a doctor. So
That's amazing. That's amazing. So, anyway, so I guess as you know, the podcast is called "Dream Big and Think Different." And I was wondering, going back to your childhood, way back when you can remember, what was your dream?
to be a professional soccer player.
Oh, really?
Yeah, and
That's amazing.
actually, yeah, and actually, so I watched the World Cup in eighth grade, and as a naive eighth grader, I thought I'm going to be a professional soccer player, and I was a goalkeeper, and of course,
Oh,
I had an
wow.
interest in diet and exercise, which
Hmm.
eventually became more of a public health interest because when I was 18, I just did some soul searching that
Uh huh.
summer, and I said, I don't really want to pursue professional soccer. I want to focus on something with more of a social impact. But what I did
Uh huh.
was I took that interest that I had in diet and exercise that came from soccer, and I moved that into more of a public health interest. And so it kind of went from one passion to another in a way.
That's amazing. Yeah, soccer is one of my favorite game too, and I'm from Nepal originally, and my son is going to be eighth grade now, and I ask him what do you want to be, and he says he wants to be astronaut. Yeah,
Even more ambitious than soccer.
but that's amazing. So you're born in United States?
Yeah, and then Long Island in New York. Yeah, yep,
Oh, New York. Okay, and you did all your sorry, your primary school there and everything in the
yep,
Long
yep, yep,
Island.
yep.
Okay,
Exactly.
where are you now based at?
In London, yeah. So I've been in London for a couple of years now, and for a few different reasons. One is that Fruit Street participated in an accelerator program called Digital Health London, which is the
Okay.
accelerator program of the National Health Service. So we've been trying to bring the product to the UK. But also, I started the master's degree program at London Business School in January as well. It's called the Sloan Fellows Program. Started about, I think, in the 1960s by a grant from Alfred Sloan. He gave a grant to MIT to try to basically build a program for mid-career executives. So it started at MIT, then expanded to Stanford, and then London Business School. And the jokes amongst all the professors is that the people that sign up for the Sloan program are having a midlife crisis. But really, it's like a bunch of talented people that come from different backgrounds, and they're just looking to sharpen their kind of management skills and
That's
thinking.
amazing.
Yeah. So
That's amazing. So yeah, I mean, I guess you've been doing amazing, and again, we're gonna go about your company in a few minutes. But why? My question to you, all the entrepreneurs have been interviewed, or all the high achievers, people, what inspire and what and who inspires you every day to be productive?
yeah, I mean, I think it's hearing the patient success stories from the patients that go through our diabetes prevention program. We've done something in the past called the Wednesday Wins, where the frontline dietitians really share success stories from patients. And over the years, we've put together 90 pages of participant, success stories where we hear from patients about how they've lost, 30 pounds and they've been able to stop taking 4 medications, or they went to their doctor and their doctor said, "How did you lose so much weight?" And it's really just inspiring stories. And I think that for entrepreneurs that are focused on having a social impact, I think one criteria you should think about, or maybe any entrepreneur should think about it, is, but if your company failed and you
Hmm.
failed to get acquired or have an IPO, and your investors lost all of their money,
Hmm.
would you still be proud of the actual work that you did and like the users that used your product? Because if that
Hmm.
happened to Fruit Street, I can say is I would be extremely disappointed that we let the investors down and that we lost their money if we fail. I don't think we're
Yeah.
going to fail, but if we fail, I'd be disappointed. But I think that not just myself, but I think a lot of the investors would be proud of the fact that we helped 45,000 patients improve their health. And I think
Hmm.
that when you're driven by not just having an exit and making millions of dollars, but you really want to, you get energy from seeing patients improve their health. I think that it gives you more energy to work as an entrepreneur instead of just being focused on the financial
Yeah.
goals.
I totally agree. I mean, same here, man. We do a few things, mostly impact driven real estate, which we are trying to focus on, three verticals: green, affordable, wellness, community, and also have a nonprofit. We're trying to build actually a diabetic center, and I think I mentioned that to you one of the call. I
Hmm.
don't even remember, but
Yeah,
actually the good news is we are advancing to India now,
great.
Dana Foundation India. So maybe we should definitely
Yeah,
reconnect some other time to discuss more about the collaboration if you're
for sure.
interested.
Yeah, definitely.
Yeah. So regarding you've been being on entrepreneurship for almost a decade. That's quite a bit of dedication, and I mean we all know that people only see success, but there's a lot of challenges, a lot of struggles during the journey. Can you share some of those?
Yeah, certainly. Well, when we started, we had a completely different product, and there's a quote about startups that I love. Let's see if I get it right. It's like a startup is a company who doesn't know what its product is or who its customers are. And the thing is that like a lot of entrepreneurs start out with one product and they finish with another, right? And so when
Right.
we started out, we had a telemedicine software product that we were licensing to
Hmm.
dietitians, and they
Right.
would pay us for the software. And then
Hmm.
we met an executive at Fitbit, and she said, "You should change your business model. Stop selling software to dietitians, and instead, you should deliver the diabetes prevention program and become recognized with the CDC." And so we completely changed the business model.
Hmm.
And I think that's just an example of how products change over time. But I think the harder challenge actually came a bit later. We had a large company that was distributing our product. I mean, it's public information called ShareCare, and
Hmm.
they had distributed our product to large employers and health plans, and we had generated quite a bit of revenue from them as well. And unfortunately, that company built a competing product and did that with stolen intellectual property, and they just moved the patients from our product over to theirs, and
Really?
so we ended up going from quite a bit of revenue to very little revenue, really overnight. Um,
Wow.
and so at that point, we thought, well, what do we do now? I mean, we did file a lawsuit and we sued them for $25 million. But really, the question became, what do we do now? Do we just shut the company down because now we don't have much revenue? Or do we look at what we accomplished and see what we can do to succeed? And we realized that we had built a product that had 45,000 patients enrolled, where we trained over 100 dietitians in delivering the program. We had
Hmm.
great gross margins. We just needed to figure out, like, what do we need to do to make this product more successful? And then I would say we got a little bit lucky because
Yeah.
Medicare changed its regulations to allow for virtual program delivery. And actually, today is the first
Right.
day. Yeah, today is the first day that Fruit Street can register as a Medicare diabetes prevention program,
Oh,
where we
wow.
will be a covered benefit.
Congratulations.
Thank you, thank you. But literally, it'll be free for 66 million Medicare patients as long as they are pre-diabetic, which is
Oh,
one out of
wow.
two. And so I think my point is in healthcare, sometimes you have to be patient because it takes groups like Medicare 10, 20 years to get on board with a proven scientific intervention, right? And so
Yeah.
I think the patience and the perseverance we had to not, give up. Like imagine, for example, that a year ago when this happened to us, that we stopped. And then a year later, Medicare said we're going to pay for what First Street does. That would have been horrible, but we
Yeah.
stuck with it and we were very, resilient. So I like to think of one of my best traits is, resiliency. You don't always know what's going to happen in entrepreneurship, but if you stick
Right.
with it and you make one right decision at a time, sometimes you'll
Hmm.
be successful.
Sure. Sure. Thank you for sharing that. We all have struggles and challenges. And what I think is, as long as you don't give up and you continue your passion and look for bigger vision, like, I guess we all know that Thomas Edison, who invented the light, tried 10,000 times to,
Yeah.
get those things done. So same with all our journeys. So thank you for sharing that. Now we're going to go to first street. I guess, your main first, I would say, baby,
Right.
preventing type 2 diabetes via telehealth. My question to you is why First Street and why diabetes?
Yeah, yeah. Well, the name First Street came from the first physicians that invested into the company. Actually,
Really?
give real credit here. It was James Toussaint, an orthopedic surgeon that trained at Massachusetts General Hospital. His wife is a branding genius. She came up with the name Fruit Street.
Oh,
And
wow.
at first, I actually didn't like it, and then I thought about it. And it's kind of like Apple computers. Fruit is healthy. Street is like you're on a journey. But it was a reference to where the company started in Boston, and the first physicians that invested, many of them had trained at like Harvard affiliated teaching hospitals. But for diabetes, like why are we focused on diabetes prevention specifically? I mean, if you look at if you look at chronic disease and you look at like the causes of chronic disease, I mean, diabetes leads to so many other issues. It impacts heart disease and stroke and blindness and amputation and dialysis. And even though the program's called the Diabetes Prevention Program, it's really a holistic lifestyle change program. Because what we do is we have a 12-month program where
Hmm.
people will video conference in a group with a dietitian and 30 people on Zoom, and they'll go over topics like diet, exercise, sleep, stress management, grocery shopping, cooking. And so if they're able to lose weight, eat healthier, exercise more, control their stress, sleep better, build stronger emotional connections with people in their life, they're not just going to reduce their risk for diabetes. They're going to lose weight. They're going to reduce their risk for heart disease, for cancer. I mean, even there's evidence around lifestyle impacting, dementia and Alzheimer's disease. And so it's really reducing their risk for a wide range of chronic diseases and also helping them feel better and have more energy and that kind of thing. So the
Hmm.
diabetes prevention program is certainly focused on preventing diabetes, but it's also focused, it'll reduce risk for other chronic diseases as well. So.
That's amazing. Yeah, and diabetes. I mean, a lot of listener want to hear more about diabetes. Is definitely a massive problem. It's top fifth or sixth leading cause of death in the entire world. I think there are about 400 million people have diabetes, and if you don't do nothing, then there's going to lead to a billion people in next 20 years.
Right.
And that's one of the reasons we are trying to. On my nonprofit, we started back in 2018 to establish a diabetic center in the underserved area of the world. One of them is in India and
Hmm.
Nepal, where I'm originally from. And in India, we did a research, and there were 100 million people affected
Well,
with this diabetes. You know, I mean, but I really like what you're doing because the prevention, pre-diabetes is another big problem. You just said one or two people have pre-diabetes, and there's about 100 million just in the United States have pre-diabetes, and 9 out of 10 doesn't know they have it, right? So that's a big, 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 big problem. And I think if you're trying to solve a big problem, that's going to impact a lot of people. And I really appreciate and what you're doing and amazing job. Tell me more about where the company is right now in terms of like, what is the major, you just talk about Medicare, any big milestone in the future?
yeah, yeah, for sure. Well, yeah, as I mentioned, today is the first day that we can finally register as a Medicare provider. And actually, the way that happened is that, well, what I would say is that in 2018, Medicare started paying for the diabetes prevention program, but they only paid for in person. Then during
Hmm.
the pandemic, they allowed for virtual delivery of the program temporarily, and they collected the outcomes data, and they found that
Great.
the virtual delivery worked really well in a Medicare population. And so the CDC basically created a new delivery type. We were
Hmm.
classified as a distance learning diabetes prevention program, which means that we
Okay.
had live classes. They created a new one called in person with distance learning component, which
Okay.
basically means the patient has the option of doing all of the program online through
Okay.
distance learning. So we changed that today, and now that we changed that, later today we can apply to be a Medicare provider, and that should be approved within 90 days.
Wow.
And Medicare will pay us up to $768 per patient, and there's no copay. And so once that happens, the question is, how do we market to these Medicare patients to get them to sign up? And there's,
Yeah.
you know, yeah, because it's
That
free
was
for
my
them.
next question.
Yeah, I mean, there's a few different ways. So the first one is that we actually received a grant from the American Diabetes Association. They have some CDC funding that they dispersed to us because they're trying to build the Diabetes Prevention Alliance, which is a network of diabetes prevention programs that are recognized by the CDC, health systems, employers, health plans. where it's a national kind of effort to enroll people into the program. So we are receiving referrals from the American Diabetes Association. We're
Okay.
also going to be doing direct-to-consumer advertising through Facebook, Instagram, maybe doing some advertising with AARP, and then also trying to get physicians to refer their patients. So if any physicians are listening to the podcast and you want to refer your pre-diabetic Medicare patients to us, you can reach out to us as well. And then also we're going to be contracting with Medicare Advantage plans as well. There's about 1,000 Medicare Advantage plans, and they are required to contract with us. So really, everything is laser focused on getting the Medicare approval and then spreading the word to physicians and patients about we have a free program for you now.
Wow.
You're listening to the Dream Big and Think Different podcast with Dr. Sachin Maskey. Be sure to stop by SachinMaskeyMD.com to download a free copy of Dr. Maskey's book.
Right now, for example, a patient, doctor, whoever wants to learn more about the program, I mean, basically, what is the criteria and like what is the steps here and what are the costs, overall? Can you go through that?
Yeah, sure. I mean, you can certainly go to fruitstreet.com and learn more there, or you can reach out to me on LinkedIn. But again, the cost for patients is zero, not even a copay. So they just have to have an A1C test or a fasting glucose test showing that they are pre-diabetic. And as long as they have that and they have not participated in another diabetes prevention program before, the patient can sign up and it will be completely free. And just to be clear, the structure of the program, it's 12 months. It's 22 one-hour-long classes on Zoom with a registered dietitian. We also give the patients a wireless scale for
1
free.
hour, you said, right?
Yep, 1 hour per class. The dietitians will share some PowerPoint slides with the curriculum, but really it's more about facilitating a group discussion. So there's 22 hours of class time in the program, and the goal is to help patients lose at least 5% of their weight. And it integrates with wireless scales and Fitbits as well. And then for the physicians, they can refer the patients to us, and it can help them with things like the MIPS program. There's certain, quality improvement metrics that can help with the physicians as well. We're both trying to build up a network of hundreds of physicians that want to refer their patients, and then of course to sign up, thousands of patients to the platform as well. But it's completely free, which is amazing. There's no copay.
Sure. So anyone can go to the website called fruitstreet.com, and there's for both patient and doctors how to get enrolled, correct?
Yeah, exactly. And we're going to start the first classes for Medicare in a few months, so you might see some website changes, but definitely fruitstreet.com is the place to monitor. Yeah,
that's amazing. Is there any other languages you guys do just as English right now? Because what I'm thinking right now, we're doing a program in Boston in September for Cure Diabetes, one of the programs from our nonprofits. We help people underinsured and immigrants, those kind of people. And I'm thinking maybe I can refer some patient to you, to your company.
Yeah.
Is it only focus on English spoken, or can you have interpreters that can help you in the program?
Yeah, we have translated the curriculum into Spanish as well. And actually, we have been thinking about translating it into other languages as well, because I think that's a big unmet need right now, is to change the languages. But it's not just about the language. It's about having a dietitian maybe from that cultural background and making sure that the food recommendations are relevant, because not everybody's going to be having salmon and vegetables, right? It has to be culturally relevant as well. So it's something that we're thinking about on our product roadmap to go even beyond Spanish into some of the other languages and cultures as well, and getting a dietitian from those cultures also.
Yeah. Oh, that'd be great. Yeah. So I will definitely have another conversation with you in regards to that. So what is your ultimate goal in Fruit Street? Let's say 5 or 10 years from now?
Yeah, well, I mean, certainly from a revenue perspective and a finance perspective, I mean, I think that our minimum goal should be to get the company to $25 million per year in revenue from this Medicare work. And that probably would require signing up about 60,000 patients in a year, or 5,000 per month, or 100.
So how many patients do we have now?
Well, we've enrolled 45,000 in total. As I mentioned, we kind of went from enrolling thousands of patients per month to zero overnight because of the Share Care
Yep.
situation. So we're on pause right now, but we're going to be enrolling the next batch of patients once we get the Medicare approval. But yeah, I think we could get to 60,000 patients enrolled per year and 25 million in revenue. But the thing is, that's only 0.1% of Medicare patients, and so that's not even scratching the surface of the 100 million Americans with prediabetes. So really, the question is, could we think even bigger? I mean, could Fruit Street get to the point where we were enrolling a quarter million, a half a million, maybe even a million Americans per year with prediabetes? I don't know if it's possible, but certainly there are 100 million Americans with prediabetes. And the CDC has said that less than 1 million of the 100 million have been enrolled into a diabetes prevention program. So we still have 99 million people that need to be enrolled. So we'd like to enroll really, as many as possible. And we'll just have to see how many we can enroll. But it's part of it's about direct to consumer. Maybe one day Fruit Street will take out a Super Bowl ad on prediabetes, but it's also about could we get thousands of physicians to refer? Because if we had, let's say, even 500 physicians refer 2 patients a week, that's 1,000 a week or 52,000 in a year. And if we can make screening patients for prediabetes and referring them the standard of care, I mean, every primary care physician should be enrolling patients into CDC-recognized diabetes prevention programs.
No, I totally agree. And I work in the facility. We have on more than 35 plus primary care provider. I've been working there for 13 years, and I guess there's highly possible. I used to do this YMCA diabetes referral program,
Yeah,
and there was a very good turnout. And the good news about your program is all virtually, right? Mostly like all
yep,
telehealth,
yep.
and your leisure of your home. And I think my question too is why do people wanna, which is going to be a kind of challenge right now, like go to a program like yours, and what is the data saying? Have you done any research on terms of success metrics?
Yeah, yeah, for sure. So we have to report our outcomes data to the CDC every 6 months, and
Okay.
they have provided us with what's called CDC recognition, which means that we
Okay.
have certain metrics around weight loss and attendance. I don't have it memorized because it's a set of 5 or 6 things.
Yep. Yep.
But that's kind of like the stamp of approval that payers look for in terms of is this company delivering good outcomes? We haven't published a paper yet, but what we're planning to do is really monitor the Medicare data,
Okay.
the data from the patients that are coming in from the
Hmm.
Medicare program, and publish something because we want to prove that this really works well in a Medicare population at scale. There's been some small papers with a few hundred patients, but we'd like to say, okay, if we enroll 10,000 Medicare patients, here are the outcomes. So we haven't published yet, but we have reported our outcomes data to the
Sure.
CDC. In terms of why patients sign up, I think patients have different motivations. Sometimes a patient signs up because they see an ad that says sign up and get a free Fitbit, and initially they have extrinsic
Yeah.
motivation, right? But the coaches that we employ and the dietitians that we employ are trained in motivational interviewing, where they try to shift
Okay.
motivation to intrinsic. So they might say okay, why are we here in the first session? Is it because we just want to lose weight, or is it because we want to have energy to play with our grandkids, or is it because we want to live long enough to see our children get married, or whatever the reason is? And then ultimately, I think after the first few weeks, when people start losing weight and feeling healthier, the reward becomes health. And there's that
Hmm.
positive feedback loop. But I think that paying people and giving people gadgets like Fitbits can get them in the door. But ultimately, you have to kind of use this coaching technique to motivate them on a more intrinsic level and give them a strong why for why they're making these changes.
No, that's amazing, and I'm sure that once we do Medicare and all, the contract with you guys, I think it's going to be massive, and and congratulations again. So let's go about briefly with other company you have started, Healthcare as a co-founder and Hippocrates VC. Can you give me a little bit of high level view in terms of how people can kind of benefit?
Yeah, yeah, yeah. Well, Hippocrates VC was basically a small VC fund I put together. It was small, just a few $100,000, and we invested in several companies. Two of them were medical device companies. One was called Avive AED. They were actually just 2 engineering students at MIT when they started, and now
Mhm.
it's an FDA approved medical device. It's a defibrillator that's much smaller, more portable, more user friendly, and I think they did a Series B. I think it was $58 million, something like that. I forgot the exact number, but that went from an idea on a napkin into like a fully functioning product. And then another one is called Smiley Scope, which a pediatrician started. She was a Rhodes Scholar, and basically it's a VR headset for kids that when they're getting like a needle, and if they have needle
Mm.
anxiety, they put the headset on, and like a Finding Nemo animation would come of like a fish biting their arm, for example. So yes,
Sure.
I did some investing. I ultimately paused it at the time because I wanted to focus more on Fruit Street, but now I've kind of matured a bit and better managing my time, and so now I've kind of relaunched another venture capital firm called Healthcare Shares, which is a similar concept of having basically having physicians and healthcare executives be investors and limited partners in a venture capital fund that would then invest in early stage healthcare entrepreneurs and support them. And so we've recently launched that as well, and we're looking for physicians and healthcare executives that want to invest in the fund that are also interested in working with entrepreneurs to build great companies. So that fund is live on Angel List now as well.
Okay, that's amazing. So what kind of healthcare company you guys will invest, and what is the like the fund in terms of investment sizes? Like what will be like in terms of like what are the check sizes?
Yeah, yeah. Well, it's a small first fund. It's going to be hopefully $10 million. That's our goal. And so the check sizes could be anywhere from 25,000 up to say a quarter million. But after we raise the first fund, we're hoping to raise a second fund that would be larger, and we could continue to support these portfolio companies as well. And actually, we don't really have a specific vertical of healthcare that we're focused on because I think then you're not really diversified. One of the great things about a VC fund is you're diversified and you're invested into different areas. If you had a fund that was, say, only focused on telemedicine, well, if telemedicine is not doing well, you're not going to get great returns. But if you invest broadly across healthcare, it's more of a
Okay.
diversified fund. And I don't. One of the things I hate about VCs as an entrepreneur who's pitched them is like they all seem to have these like very rigid rules. Some of them
Right.
say we don't lead rounds. It's like, okay, but do you do critical thinking? And it's like,
Yeah.
I like to think that the smart people that are involved in healthcare shares and our advisors can look at each entrepreneur, each opportunity, and assess it for its own merits, right? Like a lot of
Right.
VCs have passed over great companies because it didn't fit into this rigid box of whatever criteria they had. So,
Sure.
but
Got you.
but we like to think about like the quadruple aim, like things that improve public health and outcomes and reduce costs and that kind of thing.
Okay, that's a good one. So I guess the question I'm trying to again figure out here is in terms of the stage of the
Yeah.
healthcare company. Do you guys invest in like Series A or seed funding or pre-seed?
Mhm.
What level of the company you guys will be
Yeah.
investing on?
Yeah, yeah, it could be like very early stage where there's no revenue, like what most people would call pre-seed or seed, but it could be
Yeah.
Series A as well. But also, we're having kind of like a hybrid approach between venture capital and a venture studio model. There's a great
Okay.
book called Venture Studios Demystified that talks about this venture studio model, and the idea is that instead of only investing in external entrepreneurs, you could create a company from scratch. And so, one of the things we're doing at Healthcare Shares is having a free community where physicians and healthcare executives can join. And if we find good ideas, we might help them to incorporate the company and create the company from scratch where we would own most of the equity in the beginning. But then we can kind of help these entrepreneurs succeed because we have an arm of our company that does marketing services. We're launching an arm of our company that does software development. And so we may also create ideas from scratch as well.
Wow. Well, that's amazing. So, yeah, that's great. So, I wish you good luck with all the things you're doing. We are towards the end of the show, but I have a couple of more questions for you. But the first question is like, you're in London for 3 years, right? Almost 2 to 3 years.
It's been about 2 years now, yeah.
2 years. So, when are you coming back to United States?
It's a good question. I love education, and I've had a long-standing interest in going to law school.
Oh,
So
wow.
I'm just debating between whether or not I would do the online program through Syracuse University, which is one of the top online programs, or maybe come back to New York City and do like the Fordham Law School part-time program. That's kind of a good,
Oh, nice.
well suited to entrepreneurs. But yeah, so that might be next September when law school starts. So
Wow. Yeah. Look, again, another big dream you have. So my guess, I guess since this is a dream big and think different kind of podcast. So what would be what is your dream now? Like if I have to ask you.
yeah, well, I love this book written by a Harvard Business School professor called, I think it's called The Portfolio Life. And it just talks about how we don't necessarily need to have one thing, right? We could have multiple things. Like I can be, I think
Portfolio, what is the name? Sorry.
it's called The Portfolio Life. Um,
Life. Okay.
yeah. And I'm just looking up. Yep, it is The Portfolio Life by Christina Wallace. She just talks about how you could have multiple, components to your life. Like, for example, with me, I think about it as, okay, well, I'm always going to be working on diabetes prevention, but I also like investing in healthcare entrepreneurs, and I also like law, and maybe I want to get involved in other things later in life. And like life is very long, and we can be involved in, multiple things that align with our values. So, it's not like there's just one thing. But I think I want
Yes.
to use, business, technology, entrepreneurship, and law to try to, make improvements in healthcare. I mean, that's the industry that I'm interested in. And so yeah, I see it as having multiple components, but everyone should check out the book, The Portfolio Life, to see more of
Absolutely.
what I'm talking about.
No, no, that's amazing. Me, myself, I have a podcast. I have a doctor. I'm a real estate investor, philanthropist. I wrote a book. So, we can do multiple things in life,
Yeah.
as you said. You can learn new language, new book, write a book, whatever.
Yeah,
We all
yeah.
have story to share. And that I totally agree with that. So, I would have a question for you is what is your biggest win in your life and how you define success?
That's a tough question. My biggest win. Hmm. Yeah, I don't know. I mean, I might go with the same answer. There's multiple. It's hard to pick just one.
Yeah.
So I'd have to give this question a lot of deep thought to arrive at the exact answer. But if I had to answer in 1 second, I mean, I think often, well, probably being born in the United States and having that advantage. It's like, I mean, I listen to Scott Galloway a lot, who's an NYU Business School professor, and I think he has this perspective that like a lot of people are very frustrated with America right now, and
Yeah.
but it's like, if you're born there compared to like other places, I think a lot of Americans don't realize like the advantage they have in terms of their starting position. Like, you know what I mean? And I think, yeah, like Scott Galloway will talk about how like what made him successful, and he says, well, being born where he was born when he was born. And I think a lot of people want to think that their success is because of their hard work or whatever, but like people have different, starting positions in their life. So I think like
Hmm.
that's always something to be cognizant of. But um, aside from that, I mean, I'm very like grateful that Fruit Street was able to enroll 45,000 patients with prediabetes, and just we have this document that has 90 pages of participant success stories, and it's just amazing to see the patients improve their health and stop taking medication and avoid chronic disease, and that's been very rewarding as well.
Yeah, thank you for sharing that. And you're absolutely right. I'm a living example of, I wasn't born in this country, the great country in the world, United States. I was born in Nepal. I came here in 2006 when I
Mm,
was 26 years old with $2,000 in my pocket. That's all I have.
your
And
success
knew
story.
nobody, knew nobody. And, just a big dream. And, this is the country, if you have a desire to grow, learn, and there's an unlimited potential for sure. And I totally 100% agree with what the statement you just made. Being born in this country is the gift. So I tell my kids always, you are born in this best country in the world. That's the gift for you guys.
Yeah, yeah,
So I,
yeah. And it's
yeah,
like I feel like people that immigrate here from other countries, they have almost more gratitude for America than people that are born here, which is a shame. But hopefully we can change people's perspective.
but I like thank you for sharing that. But last question for today, I mean, simple question: where people can find you, and the last words of wisdom before you leave.
Well, you can find me on LinkedIn, so feel free to reach out. I'm prolific on LinkedIn, and I feel like this is probably one of your favorite quotes too, but it's always been one of my favorite quotes, which is, "If you shoot for the moon and miss, you land among the stars." So there you have
Yeah.
it.
Oh, thank you. Thank you. Absolutely. Absolutely. It's been a pleasure and honor again, Lawrence, for after a long time we've been talking, but finally we did it. I'm going to have to have a second round of interview probably in the future, but I really appreciate it. And you're doing amazing. You're so humble. And I really thought that we got connected more today. But everyone listening today or watching this show, I would really appreciate if you can subscribe and share with your friends and family. That would be amazing. Thank you so much for watching and listening. See you next time.
Thank you.
Thank you for listening to today's episode of Dream Big and Think Different. We hope you enjoyed it. Please be sure to subscribe to our show so you don't miss any gold nuggets. And we'd appreciate it if you could rate and leave us a review on iTunes, Spotify, and other platforms. Until next time.